The reason that we're having this panel, in addition to the importance of advocacy within, particularly to the Facial Pain Association and within the facial pain community, is that we received a grant from the Every Life Foundation, and that foundation supports organizations that engage patients, caregivers, and others in the community in advocacy. The Rare Giving Grant Program is an important initiative of the Every Life Foundation and provides patient organizations with vital resources to empower the rare disease community in advocacy and public policy. This recognition and support from the Every Life Foundation underscores the importance of the FPA's mission to provide support, education, and advocacy to everyone affected by facial pain. I wanted to talk a little bit about advocacy and why it's important. Advocacy and public policy are essential tools for driving systemic change and ensuring that the voices of individuals and communities are heard by decision makers. Advocacy involves speaking up, raising awareness, and influencing legislation or regulations to protect rights, increase access to care, and improve quality of life. Public policy, in turn, encompasses the laws, regulations, and government actions that shape how healthcare is delivered and funded in our society. For individuals living with chronic and often misunderstood conditions like facial pain, advocacy is particularly critical. It helps to secure research funding, improve insurance coverage, increase public and professional awareness, and influence the development of health policies that address real-world patient needs. Without strong advocacy, these communities can be overlooked and marginalized in the broader healthcare system. The Facial Pain Association has long served as a trusted source of information and support for people living with trigeminal neuralgia and related facial pain disorders. In its early years, the FPA primarily focused on education and support networks. However, as we've grown, the needs of the community evolved, and so too did its role in advocacy. Over the past few years, the FPA has become increasingly active in public policy efforts, partnering with national coalitions, engaging with the NIH, and advocating for increased research funding. We've partnered with organizations like the Alliance for Headache Disorders Advocacy, I always forget the first word, the Coalition for Headache and Migraine Patients, and other headache organizations to try to increase our voice within the headache community, as facial pain is defined as a headache, a type of headache disorder. The FPA has supported efforts to educate lawmakers and healthcare leaders about the complexities of facial pain, emphasizing the urgent need for accurate diagnosis, more treatment options, and physician training. By amplifying the patient voice in medical and governmental and research settings, the FPA has positioned itself as a leading advocate for those affected by facial pain. Its ongoing commitment to advocacy ensures that the community it serves is not only seen and heard, but actively shaping the future of care. And as you can tell, I'm reading information about advocacy, and it's very, very important to our organization, and we are becoming more adept at participating in advocacy. But the two people on this panel with me are extremely knowledgeable on this topic and are about to share a great deal more information. I'd like to introduce them. I will introduce Anna Williams, experiences bilateral trigeminal neuralgia with concomitant continuous pain, which is known as type 2. She also experiences chronic cluster headache and migraine. This led her to becoming a patient advocate. She currently serves on the board of Clusterbusters as the vice president. Clusterbusters is a nonprofit serving patients and caregivers of those experiencing cluster headaches. With the programming committee for the Alliance for Headache Disorders Advocacy and the Headache Alliance, she works to provide education in the headache space as well as plan their advocacy events like Headache on the Hill. As a patient opinion leader with the Coalition for Headache and Migraine Patients, she works with leading organizations to best elevate headache patient experiences. She is also on the admin team for the Trigeminal Neuralgia Support Group on Facebook. Dr. Juan Hincapie Castillo, you heard speak earlier today. He's an assistant professor of epidemiology at the University of North Carolina in Chapel Hill. He is a graduate from the University of Florida College of Pharmacy, where he earned his Doctor of Pharmacy, Master of Science, and PhD in Pharmaceutical Sciences. His research is at the intersection of legal epidemiology and pharmacoepidemiology, where he leverages real-world data to advance evidence-informed policymaking. Dr. Hincapie Castillo's work focuses on promoting fair and just prescribing practices in pain management and ensuring the safe use of psychotropic medications. In 2021, he joined the Center for Public Health Law Research at Temple University as a research fellow. He currently serves as president of the board of directors for the National Pain Advocacy Center and as a board member for the International Society of Pharmacoepidemiology. In 2023, he was honored with the May Day Fellowship in recognition of his contribution to pain research and advocacy. So now we will get into our talk. Anna, would you please talk about your experience with and your journey as a patient advocate?
Thank you for the welcome, and thank you for this panel. Advocacy wasn't something I knew anything about. I was a patient, and I was suffering. I've had chronic pain conditions most of my life, and in 2017, the floor fell out from under me. I already had migraine. I developed trigeminal neuralgia, and then the chronic cluster headaches were no longer managed. I had been on a medication that stopped working, and so I had all of them hitting me all at once, and I was beyond miserable. And I didn't have any medications I could tolerate for various reasons, and the doctors didn't really know what to do with me, so I continued to suffer. And finally, the doctor had a new medication they could prescribe. They prescribed it, and I got a little bit of relief. I got enough relief I could breathe. And it was like, okay, let me figure out what's going on. And that's where I started finding the patient organizations. I had no idea there were organizations for migraine and cluster headache and facial pain. I had no idea they were out there. So I started learning, and through learning, I saw other people that had the same questions I had, and now I knew the answer, so I was able to come alongside them. And that's where it started. And the more I learned, the more I wanted to learn. And so my journey started out very, very simple. It started out with me learning. And then there started being these calls to action, and we'll talk about those in a little bit, but they were asking us to send an email or write a comment. And I was like, I can do that. I've got a laptop. I'm sitting here. I can do that. And I started doing it. And for lack of better words, it was contagious. Like, once I started doing it and I realized I could do it, I wanted to do more and more of it. And what it did for me was it gave me my purpose back. And I'll be talking on a different panel about disability, but being a person on disability can really take away your dignity. And this started giving it back to me. So I started getting more and more involved. And I am one of those people that I have to try something. I have to actually do it myself. And so Headache on the Hill was coming up, and it was virtual for the first time. And I was like, I can do virtual. So I signed up for it. They trained me, and I was like, oh, I can do this, because I did it. And again, I signed up again. And then I started seeing that there's training programs. These organizations, these patient-based organizations, they need patients. They need patients who are willing to tell their stories. And so I started getting involved in that. And as I did this, I started managing better, because I started getting better and better information. And I had more people to talk to about it, people who too were on this journey that I'm on. And it just became something that was fueling me back and forth. Like, the access to information was just so much better. And so then I started realizing that, I had some connections in the headache world. And so I came to the Facial Pain Association. I'm like, hey, do you know these people? Come on, let's meet. And so that's kind of how I got where I'm at. It was just me diving in and, well, no, I didn't dive in. I tiptoed in, and then I started diving in. But it has helped give me a lot of my life back.
Thank you for sharing, Anna. So, like, for my bio, thank you, Melissa, for your introduction. I'm a pharmacist by training. During pharmacy training, you learn about, like, giving the right, this is what I talk about in the research panel, giving the right dose to the right patient at the right time for the right reason. So for me, that was like of course, that's what we're training, and that's what we're learning. But then you get into the real world and you see, oh, that's not necessarily what's happening. So that's how I got interested in research, per se, to basically use my clinical degree to then look at these data sources that are from the real world and identify where the gaps are. So that's how I got into my PhD. And at that time, I didn't know about advocacy or what it was or nothing like that. But I've always been like very passionate about serving others and just empathizing with others. That's why the reason why I did start specializing in pain to begin with, because pain is one of, I often say, it's one of the very few universal human experiences. Of course, pain to different degrees, but at some point or another, everyone might experience something they can call pain, as opposed to cancer that does affect a lot of people, but not everybody's going to be exposed to it. Pain, we are all exposed to it some way or another. So for me, that was very motivating, and it's like, which is something that there's definitely a lot of need. When I started my research career, I became very frustrated with the idea of spending all this time, all this energy, writing a paper and a study, and submitting it to a medical journal and forgetting about it. Like, for me, that was never, it didn't click to me. It was like, I am not wasting my time doing this, because if I'm using my energy, my time, my efforts into something, I want that to mean something in the real world. So I started doing a lot of work around opioid policy, with the understanding that at the time that I graduated pharmacy school, it was at the height of the opioid prescribing in the United States. Very early on, I caught up on this idea that there were so many restriction laws and policies that were going to hurt people because of access issues. So I started dedicating my time to some of this research. When I became faculty, that's when the state of Florida passed one of the most strict opioid prescription laws. Basically, for acute pain, you can only get a prescription for an opioid for 3 days of supply. And at the time, again, very restrictive. So I was concerned about like the consequences on that. And with my training using big data sources, I designed the study. I carry out the study, and of course we saw not only, of course, because it's a law, people, prescribers are writing only 3 days of supply. That was to be expected. What we saw was something very concerning, that prescribing overall decreased significantly right after the law was introduced in the state. Again, I have gotten into a lot of arguments with people saying that was the intent of the law. And I was like, no, the law was trying to limit the supply of days that you get the medication, not who gets it or not. So I started, I saw like, well, people are asking me these questions, so they really don't understand. Let me put it in a way that they can understand. So I wrote an op-ed to my local newspaper, and they published it. Then I got reached out by somebody in the media, and I've never been scared of the media. I know that some researchers are, or clinicians, but I was like, no, I really want to talk about my study. This is important. We found something significant. I'm going to talk about it. Little did I know it was a Reuters reporter, and it was syndicated, so it ended up in the New York Times, it ended up in US News World Report, and so on. That was great. Again, not my goal of, oh, yeah, me getting the praise for the research. No, for me, it's like, what is the impact that we can have, and talking about it. Little did I know at the time, too, that there was this patient advocacy group starting, the National Pain Advocacy Group, started by Kate Nicholson. She's the founder and current executive director of the organization. They were partnering with some disability advocacy groups. I didn't know this at the time. There were 2 bills at the US Senate that had a provision, just like Florida, copy-paste from Florida, that wanted to restrict opioids at the national level for acute pain for 3 days of supply. So they use my research and other papers that I published since with other evidence base to basically go to the Hill, talk to the staffers, and advocate to remove that provision. And they did it. So that was a win. And that was kind of like an eye-opening thing for me at the time, that I was like, this is what I want to do. This is the type of research that I want to do. As a researcher, as a clinician, you probably hear a lot about the bench to bedside type of translation. I always challenge that to also extend it to policy, from research to policy, because if what we're doing, spending our time researching, doesn't really change policy or laws, really they probably are not going anywhere, because law is the legal intervention, the intervention by which we can get a lot of these things done. So that really opened my eyes to using my research in a very applicable way, in a very actionable way, and I became involved with the National Pain Advocacy Group. I stayed involved for many years, eventually made it to the board, now I'm president of the board. And what I like about this organization is that we are led by people with lived experience, and that's the other thing. Like, I talk about it from the research panel, the importance of patient engagement, same with advocacy. Like, patients and people with lived experience have been doing this for a long time. As a researcher, I find that frustrating that there are not more clinicians and researchers standing side by side with them doing the work, because guess what? They are living with pain. So it's not easy for them to travel, to spend the extra energy. So that's what I become more passionate about. Like, why are more researchers and clinicians doing it? Because for me, it's like it just makes sense. If we are in this field, whatever field we are in, to advance care, to treat humans, why are we not going that step above and then actually do the extra work of making sure that our research, our clinical practice is actually helping people? So I'll stop here, but that's kind of like how I got into advocacy. This is a lifelong learning thing. I'm not an expert by any means, so I don't want you to take this panel also as like we have the ultimate truth, because there's always learning. I met Anna just a month ago, and I have learned so much already. So if you're interested in this, if you're a researcher in the room, a clinician in the room, this is where it's my call to action to you to really look at how, in what ways in your role you can engage in more activities, and happy to talk about it too. Like, this could be talking to the media. We're gonna talk about some calls to action in a minute, but there are many, many ways, and especially right now. So maybe this could be a good transition about like the current situation. Just maybe yell it in the room. I can repeat it in the microphone. Like, what under this beautiful big bill, or whatever it's named, the budget bill that is right now in consideration that passed the House, do you know what is the percentage cuts to NIH research funding? Ballpark number? It's 40%. So right now, the budget bill under consideration at the US Congress, they want to cut 40% of NIH research. Do you know what percentage of NIH research goes to pain research? Less than 10%, around 10% is the estimate. So with a 40% overall cut to the NIH budget, now is the time for us as researchers, clinicians, people with experience to really advocate for it. Of course, there are many things to advocate for. This is an urgent thing that is happening right now.
Thank you. Thank you both for sharing that. So, Anna, from a more of a layperson's level, and Dr. Hincapie-Castillo, from your colleagues, your professional colleagues, what reasons do you hear from them for not participating in advocacy? Why do you think people may be hesitant to participate?
From the patient perspective, I think it's the unknown. Like, what do I really have to do? And a lot of people don't understand advocacy is all around you. Like, it doesn't have to be testifying before Congress. It can be writing an email to your senator. It can be picking up the phone and leaving a message for your congressman or talking to a staffer. It can be wearing a shirt of awareness, and it can a Facebook post. It can be when you go to your general practitioner, even though you're there for something else, but they see trigeminal neuralgia on your chart, you make sure they understand what your trigeminal neuralgia story is, so that when they have another patient who starts talking about some of those similar symptoms, they've heard this before. like advocacy is all around you, and it can be as small or as big as you want. And a lot of times people don't know where to find the opportunities. And that is probably one of the more interesting, because we're going to talk about in a minute, I have had some really cool opportunities come my way. But it was me being connected to like a nonprofit in the field. So being connected to the Facial Pain Association, they can put out there, hey, this opportunity's out here. So if you get their newsletters, you can see those call to actions. And I can't tell you how important every single letter and phone call is. They all matter. And your patient's story matters.
Yeah, and similarly for my colleagues, it's a lot of misinformation and not knowing. So I define advocacy as speaking up to effect some change, right? So I try to demystify a little bit in that regard, that it doesn't have to be this grandiose thing where you see your very senior colleague from your field in a Senate hearing. That is actually not normal advocacy. That's actually the exception, because we not all get that opportunity. So I really try to demystify it. But the challenges, because I define advocacy as speaking up, the challenges that I have heard, especially for speaking with media, for example, is the fear that they're going to misquote me. I was like, okay, but you're still talking to them, so you can make sure that they do not misquote you. And if they happen to do it, which again is not journalistic ethical principles, like, you can challenge that. So I think it's this fear of what is the pushback, or what would be like the backlash. Maybe that's my confrontational self, or like my personality style, but I don't care about that, like, because I really lean into my values, my core values on fairness and justice. So I know what my values are. I know what activities I'm gonna be engaged in. And if I have backlash because of that, so be it. So it's this willingness to take on that and to accept it. I have done a lot of advocacy for opioids, and I have been accused of saying, oh, you're pro-opioids. And I was like, no, I am pro-patient. If the patient needs the opioid, then that's what we need. We need a well-treated patient with a good medical team where a pharmacist is involved. That's what I'm advocating for. I'm not advocating for opioids to everybody. And that's sadly where the rhetoric goes in that regard. So with my colleagues too, the lack of resources, I think organizations are doing a better job at, and I just was teaching this training at the US Association for the Study of Pain for pain researchers, training them how to do it. We had a role play. We are asking them to meet with the staffers in the Senate, because again, the NIH research budget is under threat. We had a role play on this is how the interaction might go. This is what information you can provide. I think organizations are doing a lot more to educate. I think there's still a lot of gap. And it's probably controversial, but some people really just don't want the conflict, right? They just want to stay in the comfort. Advocacy is not comfortable. So you just have to be willing to do it. I know that not everybody's gonna do it, but that's why I go back to my values. My values are fairness and justice, and I cannot say those are my values, and I'm not gonna do anything to actually advance those values.
Thank you. I think patient advocacy organizations like the FPA have a very unique position and opportunity, in the sense that we have lived experience in our patient population. We are exposed to clinical research and public policy. So we can connect the three of those. And you mentioned, Anna, a really cool experience that you got to have, and I would love for you to talk a little bit more about that. And both of you actually participated in the NASM public workshop. And so can you talk a little bit more about that?
Absolutely. So like I said, when you're connected to organizations, you start seeing these calls to action. So the Alliance for Headache Disorders Advocacy, the ones who put on Headache on the Hill. So our executive director put out a call, and she was like, hey, the National Academies has this chronic pain and disability workshop. We need a voice on it. So what I never knew until the past year or so, every place there should be patient voices, and in most places they already have that accounted for. The patient voice is like central to everything. So the clinical trials have to have patient voices all along the way. research has to have patient voices all along the way. So do the FDA, the CDC, all of these orgs have to have patient voices. So she put out this call. I signed up, and honestly, it was probably, I don't remember how long it was before I got an email asking for an interview. And I'm going to be honest here, I kind of forgot what I had signed up for, which was really fun because I get on the interview and they take the first 15 minutes and explain what this panel is, or this workshop committee. And I was like, this is a super cool opportunity. And they needed patient voice on it. And it was a really interesting process to go through because I interviewed for it, and he goes, so you're going to have a bunch more forms to fill out. He was like, I want you on this committee, but I can't put you on it. It's government appointed. I'm like, oh, that's interesting. So anyway, I get appointed to the committee, and through the process of this, so we were on the planning committee, and we were planning this 1.5 day workshop. And what was so cool was I was the only patient voice on the panel, but I was a patient voice on the panel. And the doctors and researchers, the clinicians on the call, knew the value of the patient voice. And so we created a workshop that highlighted the patient voice in ways I could not, as a patient, have even imagined. And I was so happy with the finished product. And because of how we changed the original format of the workshop, I got to actually give my patient story. And so this workshop was to educate Social Security on chronic pain and disability. And what they wanted us to do was give them information so that they could educate their adjudicators. So the people going through your disability case, so that they could make better decisions. And it was such an interesting experience to be in a room full of the chronic pain experts of our country. Like, there were so many amazing expert people in the room, and we had patients in the room, and we're experts too, because we could sit there and tell disability what the experience of chronic pain is like, and if we had gone through the disability process, we got to tell them what that was like too. And it was amazing watching the guy from Social Security, one of the guys, he filled up a notebook of notes, and he asked questions of every single panelist that were so insightful, so good. He was an adjudicator, but now he's higher level now. And so it made me feel really good that they were sitting there listening and taking notes. And so as a patient, to be in that room, I got so much more understanding of how some of this works. And it is something I can take back to the organizations I work with and say, hey, this is what's going on in the room.
Yeah, and just, I was also part of this planning committee. So this was put together by the National Academies of Science, Engineering, and Medicine, NASEM. National Academies is like, when you're a researcher, that's the goal. You want to be a National Academy Medicine member. That's as high as you can get in the United States. So when they reached out to me, I was like, absolutely, yes, I will do it. But this is another, I wanted to circle back to a little bit of like the hesitation of certain people to, or researchers or clinicians to engage in advocacy, is the fear of being sounding self-serving. Like they are there for their reasons, not for the mission. So I challenge that with like, well, yeah, you are the expert, but it's how you use the platform, right? So in this workshop, I was in charge of one of the sessions where Anna was the speaker, and I was like, we need to bring a pharmacist. We need to bring a clinician from a rural area. We really need to hear about these gaps in chronic pain treatment and management. And yeah, it feels great to be like, put in my CV, I'm the moderator and planning committee member in a NASEM workshop. Yeah, great. But that's not what I did it, not for self-serving purposes. When my grant was terminated by NIH, my heart broke for the mission of the grant. Not, well, for myself, yeah, of course, I got all the emotions and being angry about it. And even when I wrote about it in an op-ed, it was like, it's not about me as a researcher, it's about the mission, it's about pain in this country, it's about the lack of resources that we have to do research in the area. So yeah, so the NASEM workshop was a great opportunity. How do we get there? Again, those are kind of like the zebras, the horses of advocacy. When we talk about that, it's like those are one-off opportunities that are great, and we absolutely encourage you to jump into those if you are offered the opportunity. But the day-to-day advocacy, that looks very different. That looks, I try to engage in social media. I'm posting about the issue. If I can, for every paper that I write, I try to write an explainer so I can put it on social media. I contact the media people from my university to publish something that is more public-facing, that is not so much scientific jargon. And the moment that my grant was terminated, I wrote to my senators and I explained, this grant was supporting this mission. This is why this termination is not warranted, in my opinion. These are the consequences of this termination and many others. So yeah, advocacy can take many forms. The NASEM was like an amazing opportunity. It doesn't happen too often because they don't have the resources for these workshops all the time. But this is just an example of like, just remove your ego as a researcher and clinician. Like, what is truly the mission that you're trying to advance? And how can you engage in different activities through that?
Excellent, thank you. We have only a little less than 10 minutes before we wrap up, so I want to make sure that we get the opportunity to answer any questions that people have, and then we'll go ahead and wrap up. Does anybody have any questions?
Yeah.
Here, I'll
Microphone
bring
is
you a
coming your way?
microphone.
Oh, okay.
Oh, he's got it. Okay, thank you. Oh, whoops, thought there was another step.
Thank you. You can, certainly I do, and I'd be surprised if many people don't feel as though our emails and letters are completely ignored. What can you tell us about whether or not that's true, and how to change that to the extent that it is true?
So I'll start and then you can go. So when I do Headache on the Hill, we do training and we talk to staffers. And we get a lot of information from staffers. And I will not lie and say that everything is counted, but the majority of them, they do an audit of all their calls and letters about a certain topic, and they will count those up. But here's the other thing, it's about your story. So when I meet with a staffer, it's usually the staffer, I don't usually get to meet with the rep, but when I talk to the staffer, I'm telling an elevator pitch story. So like 2 minutes or less. And I'm going to fill that story with as much information that will paint the picture for them. And they're not going to so much remember any statistics I say, because anybody can throw statistics in a template email. But when you put your story in there, they start reading it or they hear it when I'm sitting in a meeting with them. I've seen their facial expressions. It sticks with them. And so when they go back to their rep and say, hey, this bill matters to our constituents, and let me tell you what this person lives with, it does make a difference.
Yeah. And your argument is completely right. In certain circumstances, they ignore the letters. One very clear example, and this is also one take-home message, please, from this session is, when there are organizations and they ask you just to put your name and that generates an email that you can just forward to your representative, they ignore them because it's basically the same text and it's just a different signature line. So what I encourage you is, if you have something to say, write it in your own words. You can use language templates as a starting place, but don't just copy paste and change your signature line because they will ignore that. They have now these AI systems that they just literally delete them. Advocacy, we're in it for the long run. Sometimes that's the frustrating part. So we have to continue the stream of contacts. I always think about point of contacts. Yes, I understand like who my senators are and where they are aligned and where we are disaligned, but I am writing almost every day on several issues that I'm very concerned about. They have to tally, and it's a matter of volume, and it's a matter of coordinated response. So right now with United States Associations for Pain Research, we are putting this coalition of pain organizations for a sign-on letter, but we're also gonna ask our members to engage one-on-one. Now, what I'm gonna say also about calling representatives is that if you call the DC office, more likely than not, you're going to have to leave a voicemail. If you call a local office, which you can absolutely can do, and they have local offices, you are more likely to speak to a human. And that I have found very helpful too. So I don't call my senators from North Carolina to the DC office. I call the Raleigh office, where I actually talk to a human and I leave my message. So to that point, yes and no. Sometimes it matters, sometimes it doesn't. For me, it's what is the long game and points of contact, as many points of contact as we can. And when you have a coordinated response, if you can get your neighbors to engage in it, if you share your story and you get others to do it, in the long run, I do truly believe that it counts. It's just a matter of like how many points of contacts can you have on the same key message.
I want to add one other thing I just thought about. So when I do Headache on the Hill and I go and so you go in and you're asking for things. And you want to be asking for something monumental, right? You want a new law enacted. And a lot of times it's not something huge. Sometimes it's adding one word to a bill that makes a huge difference. And so advocating even for small things can make a big splash.
Absolutely. I want to kind of make it clear for everyone here. We keep talking about the Alliance for Headache Disorders Advocacy and Coalition for Headache and Migraine Patients, these headache organizations. The ICHD3, which is an organization that classifies different conditions into larger, conversations, classifies trigeminal neuralgia as a headache condition. So the FPA has made a distinct effort to try to get trigeminal neuralgia and facial pain, neuropathic facial pain, understood by the headache community and talked about within the headache community, because migraine is so much more common than trigeminal neuralgia. So it just expands the conversation. So that's a lot of the reason why we have become involved in this, and the avenue that we're taking is through these headache organizations, and Anna and Dr. Hinckley Castillo have been immensely helpful in helping us get that message out. We are about at the end of time, so I know we have some calls to action, and I want to let Anna kind of wrap it up for us.
I keep notes.
Too.
So get on the newsletters, sign up for the mailing list of facial pain. I also encourage other headache orgs because, like she said, whenever you go with a bigger coalition, you're going to get more people's voices in. So sign up for those, and I read their newsletters. If there's a call to action, it's going to be in that newsletter. And when you see it, take action. If you have questions, reach out to them. I'm sure they would be glad to answer any questions. The Every Life Foundation has advocacy tools and Rare Disease Day. Headache on the Hill is it's in person in the spring, and we do a full virtual version in September, and registration is open for that. And in the next panel, I'm going to have a slide that has QR codes for the application for that, and you can also come to me. Consider talking about it locally. Talk even with your mayor and city council. So June is Migraine and Headache Awareness Month, so I got a proclamation from the Indiana governor. I've got a sign and flags that I'm going to put up in my yard. Writing op-eds. Engaging with the media, it can be scary, but your local newspaper is a great place. Let's say you wanted to tell them about, you traveled to Minneapolis to engage with the facial pain community and with the clinicians and the patients. Like, that is newsworthy. It's a really cool experience. And then you're going to find how many people local to you actually experience it as well. And then, with encouraging researchers and patients to do public comments. So I've done public commenting a couple of times, and it was not for facial pain, but it was a really cool experience to do. It was for CMS, the Centers for Medicare and Medicaid Services. And it was because cluster headache patients need a certain protocol of oxygen, and they were denying us. And we still have problems, but we did an open comment period, and that open comment period did change things. And sometimes you have to do it over and over again, but that can make a huge, huge difference.
Yeah, and just very quickly, just for advocacy purposes, so remember, there's the U.S. Congress, that's the legislative branch. You can do advocacy there. There's also the executive branch. That's where all the administrative agencies reside, right? The Department of Health and Human Services, that's where CMS is, FPA, NIH. By law, all agencies that are writing rules and regulations have to have an open comment period. This is by law, and it's 30 days, 60 days, 90 days. It depends on the institute, but anyone who resides in the United States can comment on them. You don't have to be. I became a U.S. citizen 2 years ago. I was engaged in advocacy even before that, because if you live in a certain state, those rules are going to affect you either way. So anybody can comment on that. My call to action is, if you're a researcher or a clinician in the room, maybe contact your communications officer in your institution and have a chat with them. It doesn't have to be formal. You don't have to have a product. Just ask the process of, like, if I wanted to engage with media, if I wanted to write an op-ed, what kind of support you can give me. That is a very great place to start if you're still hesitant on doing it on your own.
And I'll wrap everything up and say that we really are able to make a difference. In this last Alliance for Headaches and Disorders Advocacy, Headache on the Hill, we were able to get trigeminal neuralgia in writing in the leave behind that went to the Congress people, that all of the representatives from the AHDA went and spoke to the representatives. That leave behind mentioned trigeminal neuralgia as well as orofacial pain, I believe. So when we first started participating in Headache on the Hill 2 years ago or 3 years ago, none of the asks were even really very relevant to facial pain. But as we've continued to work, we've gotten further and further and further. It's baby steps, but it is making a difference. Thank you. Oh, go ahead.
And the flagsforheadache.org, which is our installation project, has Brandy's story as well. And the flags are for facial pain as well.
They talk about facial pain, absolutely. Thank you very much. Thank you for being here.